anatomy series right now. So today I will explain you about the coronary artery anatomy. So when anyone is performing the coronary angiography, the coronary artery anatomy is very much important for us. So when we talk about the coronary artery, we should know first what is coronary artery. Coronary artery क्या होता है? So please, you can close your eyes and you can say directly what is coronary artery. The arteries which supplies to the heart. जो आर्टरी हमारे हार्ट को सप्लाई करते हैं उसको हम लोग क्या बोलते हैं? दिस आर्टरीज आर कॉल्ड एज कोरोनारी आर्टरी। যে আর্টারিগুলো আমাদের হার্টকে সাপ্লাই করে সেই আর্টারিগুলোকে বলা হয় কি? কোরোনারি আর্টারি। আর কোরোনারি আর্টারি যে স্টাডিটা করা হয় রেডিওলজিতে তাকে কি বলা হয়? কোরোনারি एंजियोग्राफी। एंजियो माने की स्टडी ऑफ द ब्लड वेसल। एंजियोग्राफी क्या होता है? स्टडी ऑफ द ब्लड वेसल। व्हेन वी आर स्टडिंग द कोरोनरी आर्टरीज, दिस एंजियोग्राफी इज कॉल्ड एज कोरोनरी एंजियोग्राफी। Okay, so coronary angiography. So from where the coronary arteries, what is the function? The coronary arteries will supply the heart muscle. तो coronary arteries where they are present? They are present in the coronary sulcus of the myocardium. जो myocardium होता है, myocardium क्या है? हार्ट का 3 लेयर होता है. The outer layer is called as the pericardium. उसके बाद myocardium. उसके बाद क्या होता है? एंडोकार्डियम. चले, where the coronary arteries will be present in the muscular layer. So this coronary artery, suppose this is my heart, so coronary arteries हमारा ऐसे सप्लाई होता है. दिस इज द कॉल्ड एज द कोरोनरी सल्कस, और सल्कस मतलब ग्रूव है, उसी में मायोकार्डियम के ऊपर ऐसे हमारा coronary arteries are present. So what is coronary artery? The arteries will supply the heart. These are called as the coronary arteries. So where are they found? The coronary sulcus of the myocardium. So what is myocardium? Myocardium is the layer of the heart. How many layers of the heart we have? We have 3 layers. One is pericardium, one is myocardium, one is endocardium. Hi, I can see someone has joined me. May I know your name? Would you put in the comment box who are you? Now, when we talk about the coronary artery, so from where they will arise? They always arise from the ascending aorta. So, what is aorta? The largest. What is our aorta? Our aorta is the largest artery. तो ascending aorta का जो root होता है वहाँ से हमारा coronary arteries का formation होता है. So they arises from where the coronary arteries arises, they arises from the root. वहाँ पर एक fat pad होता है जिसका हम बोलते हैं coronary sinus. There is one fat layer called as the coronary sinus, and from the coronary sinus, this area, the coronary arteries will arise. So if you see it in a axial view, देखो, this is the coronary sinus like this. So anterior साइड से हमारा सबसे पहला जो कोरोनरी आर्टरी होता है, राइट मेन कोरोनरी आर्टरी, वो सर्कस से हमारा होता है लेफ्ट मेन कोरोनरी आर्टरी. तो देखा जाए तो लेफ्ट मेन कोरोनरी आर्टरी विल बी द लार्जेस्ट वन. इट इज लार्जेस्ट, इट इज थिक, और ये जो है ये होता है थिन. नाउ so what are the two branches of the coronary artery? The two main branches of coronary artery are the right coronary artery and our left coronary artery. So right coronary artery originates from where? It originates from the ascending aorta anteriorly. Ascending aorta का anteriorly, ascending aorta anterior থেকে right coronary artery কি হয়? Originate করে. What are the branches of the right coronary artery? Where it will supply? It will supply the right atrium, right ventricle. That means this is supplying our right side of heart. ठीक है. और लेफ्ट मेन कोरोनरी आर्टरी कहाँ से it will arise? It will arise from the left side, from the left coronary sulcus, or where it will be supplying? It is supplying the left side of the heart. So who supplies the right side of the heart? Right coronary artery. Who supplies the left side of the heart? That is the left coronary artery. So when we come to the right coronary artery, इसका बहुत सारा छोटे छोटे branches होता है. जैसे कि it has a SA, SA nodal artery, sinoatrial nodal artery, which will supply to the SA node. SA node को क्या बोला जाता है? It is called as the natural pacemaker of the heart. उसके बाद it supplies to the AV node via septal branches. तो AV node में maximum 90% of the heart supply comes to the AV node via the right coronary artery. 90%. बाकी का 10% it sometimes can have from the left side. उसके बाद it will be going down inferiorly as posterior right posterior descending artery which is also called as PDA artery. ये हमारा 1/3 of the ventricular septum को सप्लाई करते हैं PDA. PDA का दूसरा नाम होता है posterior interior ventricular artery. Okay, and the next from the right main coronary arteries आपको ऐसे ही 90 डिग्री लेस देन 90 डिग्री का acute angle के जैसे branches मिलेगा and this is called as the marginal arteries. MA marginal acute arteries. These are the acute arteries. Okay, marginal acute arteries. So now we will brush up the right main coronary artery. Right main coronary artery coronary sulcus से originate होता है. It supplies the where it supplies? It supplies the right side of the heart. Where it will supply? Right atrium and right ventricle. और इसका branches क्या क्या होता है? SA nodal artery, AV nodal from the septal branches. उसके बाद right posterior descending artery which will supply 1/3 of the intraventricular septum. Posterior descending artery का दूसरा नाम क्या है? Posterior intraventricular artery. Next we have the marginal arteries which is the 90 degree acute होता है. So right main coronary artery इसका ऐसे ऐसे बनेगा. ऐसे नोडल, एवी नोडल, एक्यूट, मार्जिनल एंड पीछे से ऐसे वेंट्रिकल का कोर्स करके जो हमारा लेफ्ट साइड होता है, लेफ्ट साइड whom it is supplied by? It is supplied by the left coronary artery. लेफ्ट coronary artery का क्या क्या ब्रांचेस होता है? There are two branches immediately. दो ब्रांच देता है. One it gives to the front side of the left side, front. तो इसका नाम होता है लेफ्ट एंटीरियर डिसेंडिंग आर्टरी और लेफ्ट इंट्रावेंट्रिकुलर आर्टरी. और दूसरा ब्रांच जो हमारे लेटरल वॉल में पीछे की तरफ चला जाएगा टू द लेटरल साइड of the heart and it will become the circumflex artery. So circumflex artery. Okay, so LAD will supply whom? It will supply the anteroventricular का intraventricular का 2/3 of the septum branches is given by the LAD. LCX branches कहाँ देगा? लेफ्ट वेंट्रिकल, लेटरल वॉल और पोस्टीरियर साइड में अगर ये चला जाएगा inferiorly to the posterior to the ventricles if it cross and come towards the right side, this creates the left dominacy of the heart. So ठीक है. So this उसके बाद अगर हमारा LAD का छोटे छोटे ब्रांचेस नहीं है, if it is doesn't continue as a dominating artery, then LAD will give us small branches and these branches will be called as obtuse marginal. This will come, it will supply the apex of the heart, the cruce of the heart, the pulmonary ventricles of the heart. तो ये जो LAD का डिवीजन होता है into LAD and LCX, LCA का लेफ्ट कोरोनरी आर्टरी का जो डिवीजन होता है, this happens near the pulmonary trunk. लेफ्ट pulmonary trunk जो होता है वहां पर it gets divide. Now LAD का छोटे छोटे ब्रांचेस भी होता है. The longest branch will be called as diagonal artery and इसका 3 ब्रांचेस है D1, D2, D3. और LCX का क्या क्या ब्रांचेस होता है? दे आर कॉल्ड एज ऑब्ट्यूस मार्जिनल. इसका भी 3 ब्रांचेस होता है. नाउ लेट्स लुक ऑन टू द कोडोमिनेसी ऑफ द हार्ट. तो हमारा जो हार्ट का सप्लाई है वेदर इट इज अ राइट साइड और लेफ्ट साइड डोमिनेसी, इट इज डिसाइडेड बाय द कोरोनरी आर्टरी. सो कोरोनरी आर्टरी का इफ द PDA ब्रांच in 70 to 80% arises from the RCA. RCA का मतलब क्या है? Right coronary artery and then the heart is called as right dominacy. In case of 20 to 10% approx individual, LCX will give the branch which is the longest branch coming and it will be continuing as PDA. Then we call the heart as left dominacy. अगर in case of 10 to 5% individual, PDA plus RCA per LCX पोस्टर डिसेंडिंग राइट कोरोनरी आर्टरी, LCX आर्टरी दोनों से ब्रांचेस रहेगा PDA का, तो दैट इज कॉल्ड एज कोडोमिनेसी. अब क्या होता है कि हमारे जो हार्ट होता है उसका जो हमारा coronary sulcus होता है. From here, the two branches are what? One is RCA, another one is what? LAD. Okay, so LAD, say, it will sometimes give another extra branches which will supply to the anterior part of our, this is an extra bunch. Okay, this is an extra branch which is supplying, and now we have what? 1, 2, 3, and this artery is called as intermediate artery. ये very rare दिखाई देगा आप लोगों को. So this one also you have to look at. And this is the branch of whom? This is the branches of left main coronary artery. In some cases, अगर हार्ट में बहुत ज़्यादा फैट मसल्स का डिपॉजिट हो जाता है, this हमारे जो कोरोनरी आर्टरीज है वो 10 to 15% हमारा एम्बेडेड हो जाता है उस फैट में. तो इसको हम बोलते हैं what we called it as myocardial bridge. This is called as myocardial bridge. Now, how will you understand or regulate? So ये जो हमारा LAD artery है, this LAD artery, this artery is the most common artery for the heart attack. तो हमारा जो coronary arteries होता है, they are supplying where? They are supplying to the heart and heart muscle. तो इसी से heart muscle क्या होता है? Pump करते हैं. If there is no proper oxygen supply in the heart muscle, then the patient will come across a disease which is called as CAD, जिसका नाम है coronary arterial disease, lack of proper oxygenated blood supply to the heart. तो ये जो disease is called, this disease is called as CAD, that is coronary arterial disease. Up. This all diseases can be ruled out with the help of our ECG और echo. तो अगर आपका ECG में LED का anterior wall में myocardial infarct है, तो always you will see the ST segment elevating in V1 to V4 lead. अगर lateral wall में myocardial है, ST segment का elevated होगा first lead AVL V5 to V6 में. अगर पेशेंट को PDA का ब्लॉकेज है, तो LED का लीड 2, 3 AVF को देखेंगे. The most common disease of the heart where there is a deposition of plaque in the coronary arteries is called as arteriosclerosis. This is called as arteriosclerosis. Okay, so that's some about the brief discussion about the coronary artery, its angiogram and all. Okay, so let's revise. We were talking about the coronary artery. What is coronary artery? This is the arteries supplying to the heart muscle. From where they organize? They organize from the coronary sulcus of the myocardium. And from where? Ascending aorta. What are the branches of the coronary arteries? It has two branches, right coronary artery, left coronary artery. What are the branches of the right coronary artery? SA nodal artery, AV nodal artery, right PDA or marginal branches. What is the branches of the left main coronary artery? Left coronary artery. It has two branches, LAD, left anterior descending artery, and LCX. What is the LAD function? It will supply the intraventricular septum as well as to the anterior part of the heart, left side. And LCX will run behind lateral wall of the heart and left ventricle. If LCX runs downward as a long artery, then this artery is called as the PDA, and this will decide the left side dominacy of the heart. Now, what are the branches of our LCX artery? The branches of short branches of our LCX arteries, if they doesn't form PDA, they will give branches to OM, obtuse marginal arteries. Why they are called obtuse marginal? Because they run at an obtuse angle towards the apex of the heart, obtuse marginal. And the small branches of LAD arteries are, the long small branches of LAD arteries are, these are called as our diagonal arteries. So diagonal arteries, they are of how many types? Three types, D1, D2 and D3. So which is the most longest branch of LAD? Small septal branch, that is the D1 artery. So if you have any confusions here, you can put on the comment box, and the details of this note I will be sending to the RU notes in our Telegram channel. So what are the videos you required? Please let me know in the session. I will come up with that. So see here, this is the arch of aorta. What is aorta? The largest artery. The arch of aorta has three branches: ascending aorta, arch of aorta, and descending aorta. So always keep in mind the ascending aorta will give rise to the arteries, and these arteries are called as our coronary arteries. The arch of aorta will supply to the head and neck region as a cerebral, vertebral, then upper limbs, a subclavian. These are the branches of the brachiocephalic arteries, head and neck from the arch of aorta. Descending aorta will supply to the lower limb as then thoracic cavity, abdominal area by the descending. So what are the branches of the aorta? The branches of the aorta are ascending aorta, arch of aorta, and descending aorta. So this, what is the most common disease of the heart? That is called as the atherosclerosis. Then we have the coronary arteries. If there is any obstruction due to lack of oxygen supply and proper blood, this is called as ischemic pain will be there. So the right side of the heart is always thin and left side is almost 3 times thick. Okay, next, left coronary artery is called as what? This is called as the artery of sudden death, because maximum of the stenosis and blockage happens in our left ascend coronary artery, and the most common artery, that is called as the window artery of the heart, where maximum of the blockages we can see, full blockage, window artery, where we can see the maximum blockage, and that is the LAD, left anterior descending artery. Then there is something called as myocardial infarct, which is caused due to the decreased blood flow and oxygen to the heart muscle, and this is called as cardiac ischemia. So left coronary artery is called as the artery of sudden death. Window artery of the heart is called as what? LAD. Okay, so mostly our LADs will be affected. So see here again, I am revising you. From the arch of aorta or coronary arteries arises, and from the coronary sulcus we have the right coronary artery, and the posterior surface it comes as posterior interventricular artery or PDA, and the coronary arteries in the anterior side it has small branches called as marginal acute artery, and also it gives branches to the small such as AB node as an SA nodal artery. Then it will give branches as SA nodal arteries. Then terminal branches will be there, ventricular branches. These are the small branches. And the left side it arises from the posterior aortic sulcus, give two branches. One is the anterior intraventricular artery और उसका दूसरा नाम क्या है? LAD, left anterior मतलब front descending artery, LCX. What are the branches of LAD? The diagonal artery. This is the most common branch we can see. Then it also supplies the left atrial, pulmonary and terminal branches. And LCX, if it doesn't continue as PDA, then it will be coming as our, it will give the branches which is called as the OM. So I'll show you now. This is the coronary sulcus. Anterior से हमारा right coronary artery arise हो गया है. SA node पे SA nodal artery बन गया है. AV node पे दिखाएगा AV nodal septal branch, or it will originate like this as a posterior intraventricular artery or PDA. ये हमारा जो हार्ट का सेप्टम होता है, who divides the heart into right atrium and right ventricle, this septum का 1/3 ब्रांच को ये सप्लाई करेगा, 1/3 of the septum. अब राइट मेन कोरोनरी आर्टरी से एक्यूट एंगल में छोटे छोटे ब्रांचेस आएगा, एंड दिस ब्रांचेस आर कॉल्ड एज MA, मार्जिनल आर्टरी. डन टू अस. अभी हमारा पोस्टीरियर एओर्टिक सल्कस से और एक ब्रांच आएगा, दिस इज कॉल्ड एज लेफ्ट मेन कोरोनरी आर्टरी. दिस इज व्हाट? राइट मेन कोरोनरी आर्टरी गिविंग राइज टू RCA, राइट कोरोनरी आर्टरी. लेफ्ट मेन कोरोनरी आर्टरी से LCA, it will come and split into two branches. Anterior branch will be called as LAD or left anterior descending artery, और दूसरा नाम होगा इसका क्या? Anterior इंट्रावेंट्रिकुलर आर्टरी। तो ये जो आर्टरी है ये आके ऐसे छोटे 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 ब्रांचेस, लॉन्गेस्ट ब्रांचेस देगा, एंड दिस आर कॉल्ड एज डायगोनल आर्टरी एंड दे आर टर्म्ड एज D1, D2, D3, D4। ये किसका ब्रांच है? एलएडी का। एलएडी कहाँ सप्लाई करेगा? इट विल सप्लाई द एंटीरियर पार्ट ऑफ द हार्ट। अब ये हमारा दूसरा ब्रांच जो हमारा लेटरल वॉल ऑफ द हार्ट, इट विल कम टुवर्ड्स द वेंट्रिकल, लेफ्ट एट्रियम, लेफ्ट वेंट्रिकल पे जो आ रहा है दूसरा ब्रांच, दिस इज कॉल्ड एज LCX, सर्कमफ्लेक्स आर्टरी। ये अगर इट विल have its long branch and covered the posterior inferior part of the ventricle, तब ये बन जाता है हमारा posterior descending artery from the left circumflex and it is deciding the left side heart dominancy। अगर ये ब्रांच ऐसे posteriorly elongate नहीं हो रहा है तो it will give a small small branches which will move like this towards the apex of the heart, and these are called as obtuse marginal arteries. So OM1, OM2, OM3, like this we will get sometime from our LAD और एक छोटा 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 branch निकल जाते हैं, and this branch is called as intermediate artery। So this is all about you have to know while you are doing a coronary angiography, and this is called as anatomy of the coronary artery. Till then, stay tuned with us with something more. It's a new channel with a new love, Are You Learning Academy, with your site. If you have any confusions, put on the comment box. I will put it down. Next, there are also veins which coming to the heart, and these veins are called as the great veins. So what are the veins supplying the heart? We have the great cardiac vein, we have the middle cardiac vein, we have the right cardiac vein. And where they all arises from? They all arises from the coronary sinus. This all veins arises from the coronary sinus, that is the largest vein of the heart, approx 3 centimeter long. It has 3 branches: great cardiac vein, middle cardiac vein, and small cardiac vein. And the medial cardiac vein runs posteriorly. We also have the 2 more veins, that is the oblique vein supplying the anterior part of the septum, and the posterior vein which supplies the interventricular part of the septum. So these are all the veins of the heart. So what is the veins called which supplies the heart? That is called as the great cardiac veins, which arises from the coronary sulcus. And what is the artery supplying the heart? The artery supplying the heart is called as the coronary artery.